Hello friends, I'm Dr. Nankishore. I'm a family physician and a practicing clinical sexologist. In my last video, we talked about what is erectile dysfunction, what are its types, and what causes it. If you haven't watched the video, please do it. In this video, we will see how the patients approach the physicians, investigations to be done, and the treatment. As we have learnt last time, erectile dysfunction means, simply put, persistent inability for at least last 3 months to attain or maintain an erection sufficient for satisfactory performance. Now let us see how do the patients approach the doctor. When Suresh walked into my clinic, I knew I was looking at a person who had a crisis of confidence writ large on his face. Drooping shoulders, lowered chin didn't help the matter either. He pulled his chair near me and whispered in my ears, "Doctor, I had a serious problem. I'm supposed to get married after a fortnight. Last night I wanted to say my girlfriend a goodbye. We got emotional and things turned hot. She wanted to give me a parting gift. But doctor, I got so excited that this bloody thing just wouldn't get hard. What happened afterwards is just indescribable. But if the same thing happens on my wedding night, I will be a complete goner, doctor. Please help me." It was an SOS. Suresh was a victim of performance anxiety and his condition was addressable. Here is Hamid, 26 years of age, had lost his job. He was trying to get another, but the jobs were difficult to come by. He lost his interest in life, lost his appetite, wouldn't sleep at night, his mother told me. Parents thought that the marriage could stall his depression. They got him married, but his depression worsened when he did not get erection on the wedding night. Hamid was a victim of anxiety and depression. Joseph, 35, worked with corporate sector. He was so stressed up and tired when he came home every day that sex was never on his agenda. One day, his wife forced him into having sex, but his penis refused to budge. Joseph was a victim of corporate stress. Pankaj had a troubled childhood. His neighbor, whom he called an uncle, would sexually abuse him every day when he didn't even know what sexual abuse meant. He carried that trauma in adulthood. Today, he gets shit scared when he thinks of sex. Suresh, Hamid, Joseph, Pankaj, they all had one thing in common. They all had psychogenic erectile dysfunction. Once your doctor is convinced that you have a problem, then the next step is investigations. The diagnosis per se generally doesn't require much of investigations if the history is perfect. For psychological causes, no investigations are required. Diagnosis is apparent. One very important thing to remember is if you have erectile dysfunction, but if you get those morning erections, then in all likelihood your problem is psychological. But to label someone as psychological without ruling out the physical cause is not acceptable. Hence, routine lab investigations are advised. CBC, that is complete blood count, mainly for anemia, blood sugar to rule out diabetes, hormonal studies like serum testosterone, luteinizing hormone, prolactin, FSH, thyroid function test to rule out any hormonal imbalances, lipid profile to rule out the chances of atherosclerosis. Next investigation is a color flow duplex ultrasound of penis to find out the penile fibrosis, blood supply to the penis. Doppler studies are also done after giving intrapenile injections of erection-inducing drugs. Here in this representation, Doppler studies are done after giving intrapenile injections of papaverine, an alpha receptor blocker that produces vasodilatation, to find out any aberration in arterial inflow or any diastolic leak. Let us come to the techniques that are used to treat the psychogenic ED. First is the Oedipus complex, individual Freudian therapy. Oedipus was a 5th century BC Greek mythological character who unwittingly killed his father and married his mother. The positive Oedipus complex refers to a child's unconscious sexual desire for the opposite sex parent and hatred for the same sex parent. The negative Oedipus complex refers to the child's unconscious sexual desire for the same sex parent and hatred for the opposite sex parent. These infatuations and hatred generated during childhood apparently plays a major role in psychosocial development of a child as per Sigmund Freud. Individual and couple counseling based on Masters and Johnson's concept of performance anxiety. This is generally used for premature ejaculation, but many a times these conditions coexist. The stop and squeeze technique was developed by Masters and Johnson in the late 1970s. The partner manually stimulates the patient's penis until he is close to the point of orgasm and then squeezes the penis just below the glans for 3 or 4 seconds. The partner does this until the patient loses his urge to ejaculate. Masters and Johnson claim to have 97% success rate. Present day studies do not agree with this. Third is the psychodynamic psychotherapy. It's a therapy that focuses on unconscious processes as they are manifested in the patient's present behavior. The goal of psychodynamic therapy are patients' self-awareness and understanding of the influence of the past on the present behavior. A psychodynamic approach enables the patient to examine unresolved conflicts and symptoms that arise from the past dysfunctional relationships and manifest themselves in the need and desire to abuse substances. Fourth is a cognitive behavioral therapy. It's a talking therapy that can help you manage your problems by changing the way you think and behave. It is the most commonly used to treat anxiety and depression, but can be useful for performance anxiety in ED. Maybe in some certain cases, hypnotherapy might work. The last is Kegels exercises. They can strengthen the pelvic floor muscles which support the bladder and bowel and affect sexual function. First, we have to learn to identify the muscles. If you practice stopping and restarting urinary flow during urination, you can easily identify and then practice their contractions and relaxations. This is again basically for premature ejaculation, but many a times PME is a part of erectile dysfunction. Even the patients who are undergoing treatment for organic causes should undergo psychological sessions. They may get benefited from opening lines of communications about sex and getting guidance on how best to use their functional capacity. If erectile dysfunction is due to organic cause, then the basic cause has to be treated. If it is long-standing, it would take longer time. Irrespective of the cause, following measures can be taken. One is a vacuum construction device, also called as VCD. It's an external pump that a man with erectile dysfunction can use to get and maintain an erection. The pump helps the penis to become erect, and a band attached to the pump helps to maintain the erection. The overall satisfaction quotient, though, is not great. Coming to the medicines, antidepressants like trazodone have been routinely used in erectile dysfunctions without much help. The real breakthrough was phosphodiesterase 5 inhibitors, commonly called as PDE5 inhibitors. Advent of this group has changed the whole perspective of erectile dysfunction. They work irrespective of the cause and produce results. The first drug in this class was sildenafil. Sildenafil has an interesting history. The drug was invented in 1989 for hypertension and angina. It was later realized that the drug also causes erection of penis. Its use as an hypertensive was discarded and it was repositioned as the one for erectile dysfunction in 1998. After sildenafil, the whole chain of PDE5 inhibitors followed, like tadalafil, vardenafil, abinafil, etc. This diagram represents the action of sildenafil. We won't go into the details of its action, just to make a passing mention of it. Sildenafil acts by blocking PDE5, an enzyme that promotes breakdown of cyclic GMP, which regulates blood flow in the penis. There are certain very important things about all these PDE5 inhibitors that you should remember. 1. They can be proved dangerous if taken with nitrates. Nitrates are the drugs that are taken for hypertension and ischemic heart disease. It can cause sudden fall in blood pressure resulting in death too. Should not be taken without experts' opinion. Sildenafil should be taken on empty stomach. It takes nearly 30 minutes to 1 hour to show the effect. And the most important, a sexual desire is must. Without sexual desire, all PDE5 inhibitors are useless. The drug tadalafil scores over sildenafil in some respects. Tadalafil can be taken at any time with no relation to food, while a sildenafil has to be taken on empty stomach. The second is the half-life of sildenafil is 4 hours. That means after 4 hours, half the drug is thrown out of your body, hence the effect is short-lived. While with tadalafil, the half-life is almost 17 hours. This clearly means that after 17 hours, if you take another dose of tadalafil, the active ingredients would remain in your body for much longer duration, and one can keep enjoying sex multiple times. Always remember, there are people in whom PDE5 inhibitors won't work. Surgery is always taken as a last resort. There are various kinds of penile implants. You can get it done by experts in urology. Penile prosthesis is altogether a different topic, and we are not going into the details of it. To summarize, erectile dysfunction is treatable. Identify the cause and then draw a plan of action. Have patience and cooperate with the treating physician. The final outcome might change your life. If you appreciate the video, like and share it. If you haven't subscribed to my channel as yet, please do it. My next video is going to be on yet another very common sexual dysfunction in men, premature ejaculation. Thank you.